Welcome to Hip Tips number 1, future hippies. So what is the one answer to every question you have about hip surgery and recovery? It depends. Now wait, before you turn off this video and think it's just silliness, this is really important. It's probably the most important thing that you need to realize as you plan out your hip surgery and recovery, because everything depends upon your specific circumstances. Let me start off by giving you a very specific and personal experience that I had. A couple weeks before my surgery was scheduled, I received a letter from the hospital. It said that I was supposed to discontinue taking all of the non-steroidal anti-inflammatory drugs, aspirin, everything, 2 weeks prior to surgery. I was shocked and dismayed because I'd made a lot of plans. I was trying to stay as fit and active and healthy prior to my surgery as possible, and so I had plans to play volleyball, to go on some long hikes, just to generally exercise and stay fit. But I remembered how much pain I was in when I was not taking those NSAIDs. So it really upset me because I remembered how much pain I was in before I was taking those medications and how poorly I was sleeping. So this really surprised me. Then, when I had my pre-op appointment a couple weeks before surgery, I asked the doctor about this, and I was surprised because he says, oh no, not 10 days, but 7 days before surgery. That's when you should discontinue taking all those drugs. So I was like, why is the hospital telling me one thing and then my surgeon is telling me something else? And I decided to check on some of the forums. So I posted a question out there and it said, so when did you all have to discontinue taking these NSAIDs and other medications prior to surgery? And the answers were all across the board. Some people said, oh, I had to stop taking them a week in advance. Some people said 5 days, 3 days. Some people even said they took medications the night before surgery, the same medications I was being told to discontinue. So I thought there's something wrong here. Why, if I ask 10 people, do I get 10 different answers? There has to be some logic behind this or some reason for what they're saying. So I did my own independent research, and what I found was the reason for these restrictions is because NSAIDs affect blood clotting, and they don't want you to bleed out during surgery or after. But why the wildly varying recommendations? Well, I decided to do my own research. So thanks to the great Google, I was able to find a study that went over the different types of NSAIDs and explained how they actually affect platelets, which are the little items in your blood that clot it. What I found was it depends upon which type of drug you're taking, how it affects your platelets, and how long the effect lasts. I'm not going to go into all the details here, but suffice it to say that some NSAIDs affected the platelets permanently, which meant that it could take 7 days for your body to recycle all of the platelets and get past that effect. But the effect of some NSAIDs only lasted 1 day. So why can't I take that a couple days prior to surgery? Seems like it shouldn't cause a problem. So I had to make a decision myself. And basically what I did is kind of split the difference. I tried to be a little extra cautious, but the point is you do need to be informed. And you need to make your own decisions because the information and recommendations you're going to get from other people are going to vary wildly, and they may not apply to your specific situation. So I had to make a personal decision. I adjusted the medications the way I thought was appropriate for my situation. I was able to stay active up until a couple days before surgery. And I felt pretty comfortable that I'd made the right decision. Please note, this is not a recommendation. I'm not a medical professional. I'm just sharing my own experiences and knowledge and encouraging you to get as informed as you can be so you can make the best decisions for your own specific situation. So you may be wondering, how do I use this information now? Well, there are a couple different ways you could take it. So first off, you could just take the approach of following your surgeon's recommendations and everything will probably be fine. But just bear in mind that those recommendations might not be specific to your circumstance. Hip replacements are performed on people of all different ages with all different fitness levels. I'm 55 and very fit and active. My situation, my recovery is going to be very different from someone who's 75 and inactive or has other health problems. Also going to be very different from someone who is 35. So at this point, you're probably wondering, Pete, how many orange shirts do you own? Well, depending on your preference, it's either not enough or too many. In my case, not enough. As you can see, I really like orange stuff. To really help this sink in, let me provide one more example, and then I've got a few more examples at the very end of this video in case you want some additional reinforcement. The question was, when can I ditch the walker? I'm 4 days post-op. And the answers were all across the board. One person said 3 days, except at night. Another said, you start out walking at first, but I did it at 6 weeks post-op. Yet another person said 1 month. Another said 2 to 3 weeks. And then another one said, surgery Monday, ditched it on Friday. Another said I started using a cane on post-op day 3. Another said one day you get up and just forget to use it. I ditched mine the day I got home. 2 weeks. The answers are everywhere. But my absolute favorite answer, when I found myself in a room in my house and looked around thinking, where's my walker? So remember, whenever you ask a question or looking at someone's comments on a forum, ask these 3 questions. What is their age? What is their fitness level? And was their prosthetic screwed in place, cemented, or does it rely on bone ingrowth? The answers to these questions will make a huge difference in whether or not what they're saying applies to your situation or not. So with this new information, I wish you well in discerning your own path on your hip journey. Now here are a few more examples. So here's my situation. I'm 55, very fit and active. I went home the day of surgery, climbed 2 sets of stairs to my bedroom, got into bed. I never needed a walker. I was able to sit and raise myself from the toilet by myself. Now, to show you the difference, I knew someone who was just a few years older than me, and their experience was extremely different. So first off, they were afraid to climb the stairs, so they had to spend the first couple weeks on the first floor of their house, and they could not sit down on a toilet or raise up from it. So their spouse had to get a strap to wrap around them to help lower them down onto the toilet and then to hoist them up. So that right there shows you a huge difference in outcomes. So you have to understand your situation versus the people you're talking to. As another example, there are several different surgical approaches to total hip replacement. Broadly, they're called posterior, anterior, and lateral, and people will debate back and forth which one is the best. The bottom line is there's no easy answer and no one best solution for everyone. So you have to weigh your options. Some people say it's most important to find a surgeon who's very experienced that you trust and just go with whatever approach he's most comfortable with. Others swear by one approach versus another. So you have to make your own decisions here. But when someone says that their approach was the best and that their surgeon said it was the best, everybody is saying the same thing about different surgical approaches. You'll find all kinds of different answers to other questions. When can I ditch my TEDS compression socks? When can I get back on a bicycle? When can I go running? Etc. So I hope you've enjoyed today's hip tip, and I wish you the best in your hip journey. If you found this video at all helpful, please make a comment on YouTube. That helps feed the algorithm, which makes my video visible to more people and hopefully can help them as well. Until next time, take care, hippies.
Groovy, baby.